Ishmael, welcome to the interview. Have a think about this situation, right? So, conflicts happen. Conflicts happen between colleagues. If that were to happen between you and a colleague, how would you manage that situation?
Conflict between me and a colleague. So I definitely try to approach the colleague first of all and see what's going on, assess the scenario, why is this conflict happening, is it something major, and just really try to find out where they are coming from and if there's any misunderstanding that we can clear up between each other in the first place. And if this is not the case, so if it is something that could be more severe or could be more dangerous, I would try to go to someone who's maybe a manager or someone in the HR department who can help sort it out, or maybe like all three of us could sit down and try to resolve it without anyone else getting involved. But my initial attempt would be directly, rather than creating this conflict, making it even bigger, to just directly tackle it with the person and just really see where they're coming from, try to understand them. It might just be a minor issue. And I definitely, so I do have a part-time job. I do work in a restaurant, and I have had quite a few issues, mostly with the customers, not really with my colleagues, but I have had, I think, one that I can think of now with a colleague where it was just a misunderstanding with someone else, and things were going back and forth, and I just thought it was better to directly go and try to speak it through directly with the person rather than getting a second party involved and other colleagues, and then directly go to HR. And I think that's just what makes teamwork. Like, I definitely believe that conflicts can happen. We are human. People do have differences, but we do need to learn how to see the problems from their point of view and respect them as people, and just respect them for their religion and accept whatever is happening. And it might be different, it might be a change, and it might be something I'm not used to, and which might not be happening in my life, but that is completely okay. And I'm just trying to think with conflict with also customers, which I'm thinking of now. So
I mean, that kind of relates to my next question, actually, which is, do you think conflict management skills are important for a doctor to have?
I think they are extremely important, just especially like I was saying before, with patients having issues. At times it can be frustrating, especially when it's late at night and I am tired as well, and all of a sudden there's a patient really being aggressive or just shouting. It's just, you always need to remember to take a step back and just breathe and really try to see it from their point of view and see why they are frustrated, and if you can solve that and offer them help there and then, which relates to a doctor. A lot of the times patients are going through a lot of things, which people in hospitals, a lot of the times when they are coming to see a doctor, they are at their lowest in life. Something really bad may have happened, and they might be losing a family member, and therefore emotions are really heightened, and it is a really low part in their life, which again, conflict is key for just being able to sympathize with the customers and with the patients, and see where they're coming from, and completely empathize with their situation and truly understand what is happening right now, and really feel how they're feeling, and just change little things which a lot of people don't think about. The way you're talking, maybe lower your tone and speak in a friendly way where they feel comfortable, rather than reacting in a harsh way, and really just get to the bottom of it and try to offer them help, and just really delve into that problem and see what is going on, because communication is just so key in just between work colleagues, doctors in between each other, with nurses. That's just how the whole department was run. Without communication, nothing will be happening. The communication between doctors and patients won't be getting across. The best support which the patient deserves will not be able to be continued without communication. And it's just, The health department is not a one-man job. It is a lot of people working together, nurses, a lot of healthcare professionals working together, being able to provide the perfect support for their patient. Therefore, they need to be able to communicate with the patients and understand where they're coming from. And maybe, it might be a language barrier, which again could be tackled with knowing how to understand people, which again I believe is a strength of mine, just because I do speak quite a few languages, which therefore I would be able to understand a lot of languages, and they correspond with other languages, which again I'd be able to find that middle ground and maybe understand a little bit more.
Yeah.
And yeah.
Okay. Thank you very much.
So yeah, I'd say the most important part is almost to sort of have a think about, you know, how has this conflict arisen?
Yeah.
You know, what's caused it?
Yeah.
You know, what was your initial relationship with this person like? And also sort of what is it like now? Does it need to be immediately sort of recognised and sorted out, or like how
can it wait?
Yeah, can it wait?
Yeah.
How crucial is it that you sort it out so immediately? And also, how serious is the matter that you're sort of arguing over? Will HR need to be involved?
Yes.
We need a mediator in between your sort of discussion with each other.
Yeah.
Or would it be just something that you could go up, be friendly, empathise with either side, hopefully, and then create a sort of plan moving forward so that you can both work together to find a solution? Whereas, you know, I guess...
Sorry, Ariane messaged me saying these lot of I don't know, I just opened it.
So it's... I think it's just important that you have the context of the situation.
Yeah.
Yeah.
No, I definitely think James's advice is really helpful. I wish I would have brought that into my answer, especially with been more in detail. So what is my relationship to this colleague? Is it maybe that I am in a relationship with them? Is it maybe that I'm married, or maybe like a divorce that's happening? It could be really severe, and things like this could really affect the whole entire team and everyone working in that field. So it wouldn't just be a conflict between me and my colleague anymore, but instead everyone would be involved. And just really, how severe is this? And some conflicts don't need to be like, am I maybe friends with this person since a few years already? Do you already know this person? So is it going to be awkward even if we've dealt with it? Are we going to be like, is it going to be salty? Or will it be a bit like awkward to work together? Will everyone be impacted again? It's just not a comfortable environment you want to be in, and patients will be able to see this through and be able to realize that this is not a good environment they want to be in. And then again, it might be something really major that might have happened, for which maybe they might need to change wards and they can't work together anymore.
Sure.
So yeah, it can be a lot of things, which I think I could have gone into.
There's so many things, yes, you could have added, but equally, the important thing is what have you already included in there.
Yeah.
You spoke about approaching the colleague, you'd understand what's going on. Is it a major issue? Is it a minor issue? Is it a misunderstanding issue? Do you need to involve, depend on severity, whether if it's something amicably manageable between yourselves, why would you involve the HR? You wouldn't. And we're right to say that we might look at involving them if we need to.
Yeah.
A direct approach is something you would go for initially. And you dwelled on your part-time job where you've had issues like this, or colleague misunderstanding, and you've kind of related to some of the experiences there. And I can see that coming out because, in your second part where you said, is it important for a doctor to have conflict management skills? You said quite, right from the outset, it's very important. And I agree. So there are certain situations like this where you would say, you wouldn't sit on the fence. You would say, well, it may be or it may not be. I think it's fair game for you to say, well, actually, I think it is important, actually.
Yeah.
If the question is, does a doctor need to be honest? What are you going to say?
Absolutely.
I think so. Yeah. Well, let's talk about it. Why? So some things is beyond discussion. I think it's reasonable to say, actually, we all probably do need to have some conflict management skills, whether you're a doctor or not. And you kind of talked about it from a patient perspective, which is quite refreshing because previously we focused on colleagues. but you kind of took it down the other route, which is actually conflicts can happen with our patients, between doctor and the patient.
Definitely.
What's going on and it's really good that you were trying to be empathetic towards, even in that high pressure situation. You throw in empathy, because you're right, the best way to diffuse conflict is actually what are they going through? What's going through their head right now? Why are they being so aggressive? Or and sometimes just start stopping, rather than reacting, say and swearing at them or being equally violent towards them. Actually take a pause and think, I wonder what's going through his head right now. Why is he being like that? Maybe you're right. Maybe he has been chucked out of his house earlier on.
You know what I mean? Try and put yourself in their shoes, the understanding of what they're actually going through.
For you to say, whoa, to your patient to say, oh, Mrs. Smith, gee, I'm really sorry about this. I mean, I can see you shouting at me, and then you're being quite... That alone diffuses a situation, doesn't it?
Rather than making it worse.
Can I help you in any way? Rather than saying, look, how dare you speak to me like that? Get out of here. Which happens, you've kind of you've escalated that situation, haven't you? It's going to be a relationship breakdown from there on. Instead of that, if you said, Maureen, I'm really sorry that you're having to shout at me. That in itself is a diffusing statement. That you're reflecting back to them how they are towards you. You're holding up a mirror pretty much. And then Maureen's not going to like what she sees.
Yeah, definitely.
You don't have to shout at them and show a mirror. No. Like that. I think, oh, sorry, doctor, did I... that generally that's what happens. Just holding up the mirror. You don't have to say much at all. But you're right, it is... I'd agree with you. I think you manage that quite well. I'd be happy with that kind of an answer. Of course, I mean, this is the whole thing. By all means, look at it and think, how could I have done it better? That's what it's all about. Until your last interview, keep going through everything. So I could have done that better. Maybe I could have mentioned this and I could have mentioned that. Great. Keep doing it. But I think it's important to say that, if you guys can go on the day and perform like this, I expect not one, I expect 3-4 offers for you lot. That's what I think you should be
fingers crossed
thinking of.
But I think it is more common than you think, especially in a doctor's life, because heightens, especially when you are in a hospital, when you've got these kind of issues going on, emotions are heightened a lot, and people are just venting, and obviously they are there to see family members, and if someone is seeing their family member nearly lose their life, and there are repercussions, so you would probably not mean it, but if you do really get aggressive, it could lead to something really dangerous unless the doctors are diffusing the situation immediately calming them down and working with them.
Absolutely.
It's important that doctors are able to actually put their hands up and say, I'm sorry, isn't it? I think those words are actually extremely important. Just the words, I'm sorry.
Definitely.
I mean, if you weren't able to apologise to these patients, in an A&E sort of ward, maybe they've been waiting 10 hours to be seen, and it's just ridiculous. But just to be able to sort of apologise to them, sometimes that's all they really need to hear. Saves a lot of sort of conflict that doesn't really need to happen. Rather than snapping back at them, it's important that we're able to sort of maintain that patient-doctor relationship and remain 100%. Keep the trust in the NHS and things like that, so they trust our healthcare system.
That's a really good point.
Yeah, agreed. Right, okay. Where are we now?
It's
20 past.
Yeah.